Hey everybody, David over at Frequency Frontiers. So, just before you watch this video, just to let you know that the main camera that I had set up that was all focused and nice and had everybody's face in it, that SD card failed. It was unrecoverable footage. So unfortunately, it's going to be a little out of focus. Half the faces are cut off in most of the shot. The good part is, so the focus camera I had, which would focus on most of the first aid products we're going to show and talk about today, you can see all of those and you can hear all of our descriptions of that very well. So before everybody, the comment sections light up, yes, I know it's out of frame. Unfortunately, the good camera that I had set up for that, the GoPro decided to corrupt the SD card. So here we are. I decided I'm going to go ahead and publish this anyway. Just apologies ahead of time with the cut off faces. So, and as always, don't forget, like, comment, share, subscribe, and I hope you enjoy. Hey everybody, David over at Frequency Frontiers, joined here today with my friend Christian, and we're going to do a review, maybe a roast, of my first aid kit I tote everywhere. So tell us a little about yourself. What makes you qualified to roast my first aid kit?
I'm not. I'll see you later. So Christian Logan, I'm a captain in the fire service over a heavy rescue and ladder company. Been doing it 30 years tomorrow.
Wow, it's been that long?
It's today the 10th? Yeah, 30 years tomorrow. Been an EMT for 18 years, taught wilderness first aid, wilderness medicine, ran some wilderness search and rescue teams. Just kind of been around it. Worked part-time with some other agencies to keep me out in the woods, so to speak. So being able to take care of your own emergencies as they arise is kind of a big deal. It helps not always around the corner. I guess I'm qualified.
I reckon so. I reckon I trust you a little bit.
Yeah.
We've known each other a day or two.
All right, what we got here?
All right, so that blue bag there, that is my...
We're gonna put on my eyes because,
right,
like I said, 30 years into this.
Getting a little long in too.
A little bit, yeah.
So this is my little first aid kit. I tote everywhere with everything. I always have it on me.
Okay. Well, first off, there's tourniquet and trauma shears, which are easy to get to, which is kind of the best way to go about it. All right, so, well, first roast. Let's set that tourniquet up to where it can actually be used and deployed. Because when you're bleeding out, you don't want to have to expand it out. So get it out as fast as you can. This is not the Gen 1 from North American Rescue. This is a much later generation. The first generations, you actually had 2 weaves to go through for this. They said one was for the upper extremities, one was for lower. Come to find out that if you didn't need that second one for the lower. Set it up that way. This is a good keeper for the windlass. It's absolutely pointless if you are having to use this tourniquet. There's going to be enough blood. It's going to cover the time stamp on it. Best bet is to, if you're treating someone else, write the time on their forehead, either with a Sharpie if you happen to have one, or the other thing that's going to be there, a lot of blood. We used to have really weird numbers of time for how long a tourniquet can stay on, but orthopedic surgeons have taught us much different. We have hours and hours and hours, and if it's life over limb, if I'm bleeding out, I'd rather lose my leg than lose my life. If it's a femoral artery cut, you're talking 90 seconds before you bleed out and you exsanguinate. So outside, ready to go, super important. Trauma shears, always good. With just about every set of trauma shears, even the cheapos you can buy, you can cut a penny with these. Don't do it. It's cool, it's a cool trick, but once you do that, it kind of dulls the shears. You want them ready to go whenever. So, right there, you're already set up better. So we'll go ahead and get this a little bit better to deploy out when you hopefully don't need it.
Make it look cool, so I don't ever want to use it.
I tell my guys at work that I will train the rest of my career for a call I never run if they're okay with that. I'm over it.
Yeah, I'm willing to buy every kind of first aid gear in this world if I can guarantee I never have to touch it.
I never have to use it. All right, so we got us a little hit and run kit. This is a little owie pack with some 4x4, 3x3 gauze, some bandages, a little cloth tape. This is your daily run. Oh, little butterflies. Sterile, cool, until you open it. And love marketing that stuff. Especially you're using this with your ham radio, so you're out and about in the woods.
I've already scratched, touched, and rubbed everything.
Listen, this is one of the things when I'm dealing with wilderness medicine. Sterile's always better. Once you open it, it's not sterile anymore. You're not in an operating room. Clean's better than dirty. But if I'm bleeding out and the only thing you have is a dirty, oily rag, use the dirty, oily rag. They can fix it at the hospital, but you gotta get there. So I'm not seeing any showstoppers yet. I mean, 2x3. Not saying it's bad, but it's you know, if you can just do all 3x3s or all 4x4s. I've never used a 2x3. It's small. If you're using something that small, you'll probably just do fine with one of the adhesive bandages. Save you some storage room. Instant cold pack, sure. What's your plan with these?
Honestly, I've used those things for everything. Cleaning, treating wounds, cleaning my gun, cleaning down electronics. That's like a cure-all for almost everything.
Well, so, all right, first aid world, I wouldn't really use the Q-tips for much of anything, except if you have like some antibiotic ointment in here. Yep. That just keeps it off of your fingers, because you know you don't want to touch your antibiotic.
Blood, yep.
Yeah, I don't see any gloves in here either. Any latex or nitriles. If you're cleaning wounds, just about everything we talk about is irrigation.
Yep.
So in a lot of my kits, I keep 60 cc syringes, but you can take and dump all of these out, fill your little bag with water, and maybe cut a little hole there in the corner and create pressure to irrigate water to clean a wound. That may be the best bet of that one. Not saying it's not wrong, but there's just
a fix-all, cure-all thing that can do. If I don't have anything that can do it, that probably will.
Mouth-to-mouth CPR. Yeah, we have talked about compression-only CPR in the CPR world, and the last numbers I saw give 7 to 10 more minutes of viability. Compression-only CPR is not going to save a life. We did see that several hours after death, the O2 saturation in cadavers was something like 80%. So compression only still moving oxygenated blood around the body. However, there's got to be new oxygen introduced. So while we were talking about compression only CPR for bystanders or witnesses or caregivers who were reluctant to do mouth to mouth, a lot of these came out. These are real thin. They're one-way devices to give you a barrier between that and your patient. You're going to get messy.
Yep.
CPR is messy. The patient will start regurgitating. Spit's going to come out, and these, they're just, by the time you see chewed up turkey and gravy on one, you're like, yep, yeah. So
give you about half a second, get out the way.
Yeah. If you don't have this, use a patient shirt. I tell my CPR classes that, especially if I'm doing CPR and an AED is anywhere near.
Yep.
I'm gonna wait a minute.
Yeah, check it out.
So if I'm doing a CPR class and an AED is anywhere near, or if I'm performing CPR, everybody's getting their shirt taken off. Back to the trauma shears. I have to be able to see certain landmarks to be able to put my hands in the right spot to get compressions. So if that shirt's coming off, be it male or female, you know what else makes a good barrier? Pull their shirt over their face. It's going to help. Obviously, it's messy.
Good barrier, good filter.
Yep. I got the instant cold pack for twist ankles and owies. This is very huge right now. There's a big push a big understanding now that especially in it's an emergency blanket if you can't read it. It's a heat shield, wrap it up. There's a bunch of different algorithms and abbreviations for dealing with traumas, and most every one of them I know ends with an H, as in hypothermia, because as a patient's going into shock for a real trauma, especially if we've had to use this. The body is going to go into shock, which is going to shunt all the blood to the inside. Your body doesn't want to die. It's going to try and protect heart, lungs, brain. All the blood is going to be pulled to the core, and they're going to start heading toward hypothermia. Well, hypothermia is one of those wonderful conditions that is so much easier to prevent than it is to treat. That emergency blanket is a very good idea. So, your little hit and run kit, 2x3s, in my opinion, kind of pointless. 3x3s, cotton, gauze, tape, little finger owies. Yeah, absolutely. I don't see any antibiotic, AAA. I'm not a huge fan of Neosporin, but some sort of antibiotic cream. Maybe you could add a little 10cc syringe here for wound flushing. Also, an antibacterial hand sanitizer, something like that. And you said you were going to be putting
Benadryl and ibuprofen as a chewable children's medicine.
Diphenhydramine, which is Benadryl, and ibuprofen. If there's room, children's baby aspirin.
Yep.
For any cardiac pains. The dose for an adult is 325 milligrams. Well, 4 baby aspirin winds up being 324. So, chewable, just for any cardiac events. And, for first aid, for, shock and all, yeah, this gets you started. I don't see any, like I said, there's no showstoppers here.
Yeah, like I said, that kit there, that is, I have it on me everywhere. That's going to hopefully allow me enough to provide you some sort of aid until somebody else shows up with something better.
Mine's a little bit bigger, my everyday go everywhere kit. I like Olier's dressings, if you ever want to look into those. It's kind of the next step for me as opposed to an Israeli dressing, which the Israeli, yeah, nothing wrong with it, but it's kind of a one-trick pony. It is a pressure dressing designed for massive bleeding. And say it's a vein that's been cut and it's just oozing, well, a tourniquet is not appropriate for that. Tourniquets are for arterial bleeds. But if it's a big, heavy bleed of a vein, I still want to stop it. So the Israeli was one of those. And for some other areas where you can't tourniquet. You can't tourniquet in junctions, what we call junctional wounds. Obviously, you can't tourniquet around the neck. Luckily, aside from the pulse points in the human body, aside from the pulse points, the arteries are very deep. So it requires a pretty significant injury to affect an artery. Now, where you find your pulses, that's where the arteries get closer to the surface and we're able to put pressure on them to get your pulse. So, having an arterial bleed is pretty special, significant event. In all my time, I've never worked one. I have seen tourniquets deployed. And sure, go ahead, but it wasn't arterial. But back to the Olier's. Yeah, so the Olier's dressing, not only is it a pressure dressing, it comes with some plastic that can be used for an occlusive, same as some of those plastic bags and tape. But inside, as opposed to just being a pressure dressing and a wrap, it has the dressing, the occlusive inside. It has another plastic cup to be used for pressure or an eye wash. But inside what you would consider the bandage side is S-folded gauze.
So I can get down in there.
wound packing for puncture wounds, or the deep, the venous bleeding that a tourniquet is not appropriate for, or something that you can't get a tourniquet on. You can actually pack that wound and then put a pressure dressing on top to create the pressure inside the wound against those bleeding blood vessels. But that's about the size of what I carry, and I'm a huge fan of the North American Rescue Cat Tourniquet, which is that one. Soft T makes a good tourniquet, but it doesn't go small enough for children. Found that out. It doesn't. You can't get it around the arm or the leg of, say, a pre-K kid. And I did a lot of teaching to schools, bleeding control and shock management and school shootings. It's a horrible thing. It's the time we live in, but and I keep some soft tees in some of my like shooting gear, some of my hiking gear. They work for me, but for just an all-around, it's going to work. That's the one.
That's why I went with it.
So
it's simple. I can use it, and it'll get the job done.
And they're local boys. They're just like an hour and a half up the road from right here. If you're watching North American Rescue, hey, Palmetto Rescue Tech, still one of your vendors. Say hi.
All right, guys. Well, I appreciate everybody for watching, and don't forget, like, comment, share, subscribe. 7-3. Till next time.